with some equipment, correct? Okay. Do any of these items look familiar?
Yes.
Okay, so which one are you using? Obviously, this to put the sock on. Okay, and then for pants, what are you using?
This guy?
The reacher.
The reacher.
Okay, so I'm going to demonstrate for you how to put on pants. I had a chair. Great. Here, it's okay too. Seriously. Okay. The thing about swivel chairs for back is that they can make you like move kind of in a jerky way to try and stay balanced. Probably not the best thing for a while. Okay? There's another little tip there. So when you go to put these on, you're going to your pants, right? You're gonna shake them out, and then you kind of drop them to the ground, shaking them out, right? Put them on the ground, take your reacher, put it on each leg, okay? And then slowly lift, using a reacher, lift those pants up towards your knees. Okay, is your left leg a little bit weaker or not?
Just a little bit.
Okay, then I would try and get the left leg in first.
Left leg in first. Okay.
But I find that you're more efficient in your use of time if you put both legs in to pull them up, to get them started.
Okay.
And then once you're able to reach it without doing a lot of bending, you're just gonna pull them up to here.
Okay.
Okay, because I see that you're already dressed for today, so we're just going to go ahead and practice.
Okay.
So, do you use this to also remove it? Okay, so you can do it this way. Push them down. And then once they are down, you can go ahead and use the reacher to bring it up for yourself.
Okay.
Okay. So, do you want to do this first?
Sure.
And then we'll work on the socks.
Sure.
I'm gonna give this to you, and this is right here.
This guy. Left side first. That's easier to do both.
You'll tell me when if you need some help, okay?
Now this part, can I bend forward to go grab them?
No, you want to try and get them to your knees and then,
And
yeah,
then pull them up.
and then pull them up. Perfect. Okay, do you want to get your legs through? Just show me how that goes for you.
Okay.
I imagine with that left side being a little weaker, it's harder to do some of these things, right? Okay. All right, nice job.
Now I can pull them off.
Okay.
Push this out.
Beautiful. Okay, so you've been working on this, huh?
Yeah.
But I heard from Sharon that the reacher's still kind of awkward for you to use, so maybe we'll get some practice with that. This is going to be a good tool for the next 3 months total, which is now 2.5 months, right? And with that, we want to get you some practice with doing that, so it'll be very smooth. I think, like most things, once you practice, things get easier.
Okay.
And so the yellow ones are yours, correct?
Yes.
Okay, so I brought these in today, and this is the sock aid, which you've been probably using, right? So just as a reminder, you're gonna put that between your legs, heel side down, stretch it open, and you can pull it on. You wanna make sure the top is all the way tight. Okay, leave some room for your foot. You lower it down, you put your foot in. Now here's something that I don't know, maybe Sharon has told you. You go nice and slow and you point your toe. That's kind of my thing. Go nice and slow, point your toe. Sometimes when you do it super fast, it doesn't go on all the way. But when you go point your toe, nice and slow.
Okay.
Okay. And then you can use the reacher if you've been using the reacher to help remove it. Sometimes people use the pin at the end here. Sometimes they use the jaws. To remove it, I also find that if you go right in the middle of your heel, it ends up coming off much quicker.
Okay.
Okay? Look at. So let's see how that goes for you. Put this right here. These are yours. And I'm gonna stand right here. Let me know if you need some assistance.
Okay.
Okay?
Here, ankle side down. Here. Down.
Is that still difficult for you? Would you like me to assist?
Yes, please.
I think as that hand gets stronger, it will be a lot easier. But
Thank you. Bring it down.
certain socks are a little bit easier going on there too.
Yeah. So point my toe.
And go nice and slow.
Go nice and slow.
Okay. Success. And right in the middle of the heel, it seems to go a lot easier. Look at that. Beautiful. Awesome. Okay. So you did not really need much help at all except to put it on here, so might be minimal assist. And then with your pants, what I noticed is you were able to do it just with a few cues. So SBA or supervision sound standby assist.
Okay.
Okay, how are you feeling?
Good. A little tired, but it's good.
Okay, so I'm going to put my shoes back on, but I'm going to have you take some nice deep breaths while I do that, and then we're going to go over and check out your standing balance.
Okay.
Okay? Okay. And in order to do that, I'm going to put the arms of the chair back. Give your arms back. Okay, standing balance, as you know, is really important for reaching into the cabinets, hanging clothes up in a closet, or getting them out, or any number of tasks. Okay, so I'm going to lift your feet up. I'm going to pull you back. And we're going to go over to the standing area here. So you had double slipper socks on that have grippers, huh? That must have made this even more challenging, huh? Put on your slipper socks. Okay, so I know that you've done this before, but I'm just going to state it for the record. Once you're standing, if at any time you feel like you need to sit back down, you just let me know. Typically, when I see patients start to show some signs of fatigue, I usually cut it short for them, okay? Okay, so first thing I want you to do is scoot forward in your chair. Okay. And I'm gonna hold on to your gait belt, no problem.
Okay.
You're gonna push up from the chair arms and then hold on to the counter. 1, 2, 3 up. And I'm gonna mark the time. Okay, nice wide base of support, looks good. Holding on with 2 hands. I'm going to push you around a little. Stay as steady as you can, okay? Good. Very good. And then backwards. Okay, that looked pretty good. Put one arm down at your side. If at any time you need to go and hold back on, you can go ahead and do so. Okay, I'm gonna push again. Good. Good. Nice and steady. Push back. All right, that looks good. Okay, would you put your other arm down at your side, and if at any time you need to hold back on, you can go ahead and do so. Okay, here I go. Okay, put your hand back. You do feel best, right, when you're holding it on with at least one hand. But what I'm seeing is you're also looking a little bit tired. So what I'm going to have you do, we're calling time on this one. And you stood for a good 3 minutes as compared to 30 seconds the first time. So I think that's great. Let's go ahead and reach back for the arms of the wheelchair and come and sit back down nice and easy. Okay, take some nice deep breaths. I'm going to wheel you back just a little bit. And we're gonna take your blood pressure again, okay?
Okay.
Keep those feet. Here. Thank you for the chair. Okay, blood pressure first. May I put this on your shirt? We go. See that they pumped it up to 200. And here goes. Okay, so what I noticed about this one is it is at 140 over 80. That's gone up quite a bit in a short amount of time. And let me take your heart rate and I'll tell you a little bit more about what I'm seeing in terms of endurance and how that all relates.
Okay.
Okay, and your heart rate's at 100 beats per minute, which says your heart's been working a little bit harder, right? The going up from resting heart rate to after all these activities, and we did that in the course of about 30 minutes. It tells me that your endurance is somewhere between poor and fair, because your heart's working harder. When it does that, that tells me that your endurance is struggling a little bit. So we can still work on that, and I think as you're coming along, you might find that that endurance comes back very slowly, but it comes back.
Okay.
Okay? Okay. We are finished with the assessment part of what we of our session today. Tell me, how do you think you did?
I think I did okay for the most part. I struggled a little bit with the pants, but I think I did okay.
Okay. What I'm seeing is bed mobility, you've done very well, just a little bit of hands-on, like a contact guard, just a little bit of direction. I saw that you did well with following the transfers. That seemed to work really nicely. For joint motions, your left side is still a little bit less motion than would be necessary. So we're gonna work on that a little bit. Muscle strength on this side is doing great.
Awesome.
Okay. Coordination, it looked like that was coming along. I saw from before it was at a poor, now you're at a fair. So maybe you're still having some challenges with buttoning and tying, but we're gonna work on that as time goes on.
Okay.
Okay. In terms of getting dressed, you needed just a little bit of support, but your use of equipment, you seem to know exactly what you were doing with it. Says that you've been practicing, which is awesome, and we'll continue to work on that. Standing balance is at a fair, as is sitting balance.
Okay.
And that means you need one hand to hold on. We want to get you to the point where you don't need. You say, look, no hands, right? And the tolerance with that also, which speaks again to some endurance issues.
Okay.
So I think there are plenty of things we can still work on.
Okay.
One of the most important things before you leave here is to know your precautions and how to do them in a lot of everyday tasks. So you said that you do a lot of cleaning. What I'm gonna have you do today to reinforce no bending, no twisting, right, and no lifting of anything over 5 pounds. And using the adaptive equipment to protect yourself.
Okay.
Okay, so we're gonna do this while you're in sitting.
Okay.
Do you feel comfortable if I remove the arms of the chair again? Okay, so you have the back of the chair if you need it, and I am here because you still have the gait belt on. But what I'm gonna have you do today as an activity is to practice using the reacher while picking up a lot of different cleaning supplies.
Okay.
Okay, so I'm gonna put this in your reach. I'm gonna use tables. There's a lot of equipment in OT. Have you noticed?
Yeah.
People leave dirty laundry around.
Yes.
You have to pick it up.
Yes. It's annoying.
It is. How about you? Do you leave dirty laundry around?
Yes.
I think at some point we all do, right?
Right.
I also am going to throw some unusual things down. And so we'll give you a couple things to that looks familiar, I bet. Okay. If it's not something, if you think it's too heavy, then guess what do? You leave it there for someone else to pick up.
Okay.
Okay? No over 5 pounds means your back is going to be protected until it fully heals. So what I'm going to ask you to do, another thing too, is so once you pick something up, in order to turn, you're not going to twist. We're going to literally move the wheelchair
Okay.
so that you're facing the object,
Okay.
where you're putting it. So I'm going to have you pick up objects one at a time and put them right on this table.
Okay.
Let me unlock the wheelchair and go for it. Okay, do you need to move?
Yes.
Do you need to move?
Yes. I need to move that way. Thank you.
Do you need to move?
Yes. Uh-oh. It's kind of too heavy, Adrian.
Okay, then leave it.
Okay.
Let's check something else out.
Oh, that's kind of heavy too.
Okay,
I'll leave that one there.
and okay. So now take some good deep breaths. That looked really well. We can do another round. another day. We've
Okay.
done a lot today, otherwise we'd probably incorporate more things.
Okay.
Things that I noticed, can you tell me what precautions you used during this task?
I made sure that I didn't bend.
Okay,
I made sure that you helped me twist to the other side so I don't twist.
okay,
I also didn't pick up anything that was too heavy. I left it there for someone else.
beautiful. Do you think you might be able to use these in a lot of tasks that you do at home?
Yes.
Okay, well, we're going to end our session today. Do you have any questions for me? Okay, the next time we get together with me or with Sharon, depending on who's here, we're gonna work on continuing to use the equipment, especially to get dressed.
Okay.
We're gonna work on that a little bit and maybe work on shoes
Okay.
and underwear, right? And then if you have any other questions or concerns, we'll go ahead and start working on those as well. Okay?
Okay.
Great to work with you today.
Thank you, Adrian.
I'm just gonna clean up.